Hello and welcome to the Mouthy Matters podcast. I'm your host, Tasha Kozlowski. I have been a dental hygienist for 20 years, turned practice coach where I help dental teams connect the mouth to the body. Today is an exciting episode. We are talking all about bleeding gums. So if your gums are bleeding or they've ever bled and you're wondering what in the world is going on, that's what we are diving into. I am here with our co-host, Lisa Charles. She is my bestie and has been with me on this ride for a very long time. So I thought, who better than to ask me all about bleeding gums than Lisa? Lisa, welcome.
Hey there. And just for all of you listening and watching, if you are the patient, I am you. I am not in the dental field, but I feel like I'm an honorary dental professional through Tasha and just walking alongside her in her path these last 20 years together as friends, and then also getting to witness and help support her starting this incredible business. So today, especially, I'm going to be asking the questions that you would be asking. Maybe you're sitting at home or in the car and you're thinking these questions. Hopefully we get some of those answers today.
I love it. Let's
All
dive
right,
in.
let's do it. Okay. Number one is, okay, we keep hearing about bleeding gums and you tell me my gums are bleeding all the time. If it's so common, why is it such a big deal?
Totally. So I have to be honest with everybody. When I was a young early hygienist, I actually believed that everyone's gums bled a little bit because I saw it so much in the dental chair. And it wasn't something that I personally was prepared for because in hygiene school, you do clean people's teeth, you do all different kinds of dental treatments to help people get healthier gums, but you don't actually see a whole lot of patients. I mean, you may have, one patient for your whole day. So then when you get out in clinic, you're seeing roughly 8 patients a day. Some practices see even more than that per day. I can't even imagine as a hygienist seeing more than 8 patients a day. But it is very common. And what we actually know now is that dental disease in general is, according to the World Health Organization, is the most common disease out there. Dental cavities are actually even more common. Untreated dental cavities in adult teeth are actually more common even than periodontal disease, is what the World Health Organization has said. Even companies like Listerine have done worldwide studies where they found that 90% of the world's population has some form of chronic gingivitis. What that means is some type of chronic bleeding. And that's Listerine trying to sell more Listerine. But still, I mean, it's really, really common, but it's not normal. And the part that I didn't understand when I graduated was that there was a reason for it that had nothing to do with plaque and calculus on people's teeth, debris on people's teeth. What's actually going on is that we've come in contact with some unhealthy bacteria. Our immune system didn't fight them off and we got sick. So kind of like, Lisa, have you ever had strep throat or had the flu or got a virus?
No, never. I'm the, picture of health. Yes, of course.
So when you have, did you think like, oh gosh, dang, I haven't been showering very well?
I have thought, man, I should have washed my hands after I touched such and such. But no,
Exactly.
obviously,
Because I
I
touched
came
something,
in
I got into
contact
something.
with, yes, bad bugs.
Bacteria. So our bodies have depending on the study, our bodies have more bacteria than they even do cells. So we're full of bacteria and most of them are really good and really, really protective. But there are some that actually are really, really harmful to us. And sometimes, our lives are super stressful. We don't do as good of a job brushing and flossing or water picking as we should. And sometimes we're just not getting enough sleep, or maybe we have some other underlying health conditions on our medical history, some autoimmune disease. I mean, there's so many different things that our bodies can have. And so if we come in contact with those bacteria, they actually like to live inside of our gums, not just on top of them, which is why you can do an awesome job at home but still get sick, just like getting strep throat or the flu. And unfortunately, a traditional cleaning from your hygienist isn't enough to take care of it.
I guess that makes sense, that it's deeper than just the surface that I can brush at home.
It is. It is. It is. We need,
Okay,
I
well,
like to tell people we found something different, so we need to do something different.
that's a great way to put it. It definitely, it's the definition of insanity, right? You can't keep doing the same things
Exactly.
expecting different results. So,
Yeah.
well, that leads me to my next question, which would be, there are so many people who feel like, hey, I'm brushing and flossing at home and I don't see any bleeding, but I come in here and suddenly you're finding all these problems and you're telling me that I have bleeding gums. How can both be
Yep.
true?
I love that. I love that. So, how can both be true? So, if I'm brushing my teeth, my goal is cleanliness, and not all tooth brushing techniques are the best. So, the way that I like to inform patients to brush their teeth with or without bleeding gums is not just to brush your teeth. Every surface in your mouth can get these bacteria that I was talking about. So, brushing your teeth and your gums is super, super critical. I like to also use a tongue scraper. I like a copper tongue scraper because it's naturally antimicrobial and because of the very even edge on a copper tongue scraper. You can get these on Amazon, guys. Um, is 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 not gonna, like, dig deeper into your tongue or create any, like, fissures or, like, accidental cuts or anything like that. So it's good to use some type of a tongue scraper. If you're not a flosser, you don't like flossing, then use a water pick. If you're gonna floss, like, I floss when there's food stuck. I water pick every single day, probably twice a day, because I have a lot of recession, so there's some food traps in there, and it's just easier for me to water pick. So when we go to the dental practice, part of what our job is as a dental hygienist is to assess your gums, not just to clean them, but to assess your gums to see if they're healthy or not. And so part of that assessment is actually using a specific dental instruments to get underneath the little space between the tooth and the gum. And that can get into nooks and crannies that you can't reach at home very well. And the outside of the gum tissue is what's called like keratinized. I like to think of this as like a construction worker's hand sometimes can be a little bit harder on their palms because of all that friction. The outside of our gums is tougher than that little space between the teeth and the gum. Because if you're biting
Mm.
into a potato chip or something like that, you wouldn't want your gums to just like all of a sudden get a laceration. And so that tiny little space between the teeth and the gum are what we're looking at. And those areas are harder to get to at home. So if we slightly go past that when we're doing our assessment, we may find bleeding more than you because your process is to clean. Our process is to assess and actually look, could there be anything causing you harm? As you know, love to take it one step further and always take a plaque sample to put it on the microscope to see, do you have healthy bacteria living in your mouth or do you have bacteria that should never be found in a healthy mouth? Because if you do, then I know right away, bam, hey, Lisa, you have a problem. And so that assessment piece is just a little bit different. And so it's actually super common to not notice it at home, but we notice it in the office unless it's a pretty severe infection. And so once you start seeing bleeding at home, it's worse than just like your dental hygienist finding it. It means that you probably have an infection that's been hanging around for a little while.
Okay, so as a hygienist, because I know you and I have talked about this in some of your videos. So you know that patient is going to be like, well, I think it's just because you're rooting around and digging down deeper in there. Or I just had some popcorn last night. What do you say?
Totally.
Something like that. There's going to be some excuse or reasoning behind it that doesn't involve an infection or termites in the foundation, like you've talked about. What advice
Yeah.
do you give to that hygienist in that moment? How do they communicate that this is not just a one-time thing? This is a bigger
Yeah.
issue.
Yeah. I mean, even my husband came home one time, like a year ago, and was like, man, that hygienist was rough in my mouth. He's like, I don't want to go see her again, Tasha. And my immediately what my was thinking was, "Well, what do you have living in your gums? Because it sounds like you definitely have gingivitis. If you're cleaning hurt, she must have been trying to get some stuff out of there and maybe felt a little insecure about diagnosing you with gingivitis or something like that." And so the more we talked about it, and then of course I reached out to the practice and was like, "Hey, what happened at Chad's visit?" And they're like, "He had gingivitis."
Of course you
Apparently,
did.
he
Of
got
course you did.
amnesia during that part of the conversation because that was what was going on. So, essentially, if the practice that somebody is seeing doesn't have a microscope, it can be much more difficult to articulate the changes that we're seeing because it is confusing as a patient to go like, "Nothing hurt until you started poking me with that notch metal stick." Like, of course it hurts. You're digging around in there. But what's actually happening typically is that the gums are slightly swollen. And we're talking just millimeters, like the tiniest amount that you can't always see visually. But again, our instruments can get into those tiny little nooks and crannies. So when we touch them and they're swollen, it gives the gum tissue a paper cut. So it's like if I'm walking around with a paper cut on my finger, but I don't touch it, it's fine. But if I start like pinching that paper cut, it hurts. So it's just like that. It's like the patient has a whole bunch of paper cuts because the gum tissue underneath where you can't see, it actually is lacerated. It actually does have these tiny little cuts all along the underside of it. And that's how the bacteria can get into the gum, into the bloodstream. But you can't see that. And when we're brushing, we can't get underneath there either. So you're not touching the paper cut, so to speak. And so my suggestion is always just to explain to the person like, hey, I'm seeing redness, inflammation, and even bleeding. This definitely appears to be a sign that you have a gum infection. You came in contact with some unhealthy bacteria and your mouth got sick. And so the traditional cleanings that we do should really be more like a car wash. Like you're just really shining things up. You're doing an assessment to make sure everything looks good. But if somebody has bleeding in their gum tissue, that's never normal. I mean, it's only normal if, okay, so let's say you did eat popcorn last night and you got a whole lot of popcorn kernels stuck up in your teeth. And then you had to floss to get all those little buggers out of there. And sometimes floss does not get kernels out. So I highly suggest get a water pick to blast them out because it's a lot easier. You may cause some abrasion and you may see some bleeding, of course. Now, as a dental hygienist, I will say that irritation and those types of abrasions do not present the same way as a gum infection. Now, to the untrained eye, you may not know the difference. But when we're in there, we can see floss cuts, we can see different
Mhm.
types of abrasion, and a gum infection doesn't look the same to us. So maybe an easier way to think about this is for me, if I see anyone that has a crown, a veneer, a bridge, any kind of dental restoration that's not their natural tooth, I can spot it from a million miles away. But I still had patients that came to me and they'd say, Tasha, this one's a veneer right here, so don't polish. And I'm thinking, I know it is. Of course it is. And I also have your dental chart and I have your x-rays. Like I know, but they don't know I know. So it's one of those things that when we're trained to see something, we just see it from a mile away. But if that's not their wheelhouse, like they're not going to notice it. Like,
Yeah.
I mean, my daughter will ask me, Mom, she'll say, some of the kids in my class, they'll come to school and they have some food between their teeth. How can they not see that or feel that? And I just think to myself, oh, you poor thing. I've really rubbed off on you.
Yeah.
So, does that answer it? I kinda went on a few different tangents there, Lisa. Maybe I didn't hit the nail on the
No,
head.
I think you did. I think you gave language that people can actually use, that the hygienist can use in that chair. But you also hit on something else that you didn't mention in the answer of the first question, which I would like to point out because to me, it's one of the most important things. When you're talking about bleeding gums and why it's a problem, it's the biggest issue is because our mouth is not in a box. And you talked about how you have these tiny little micro lacerations or cuts underneath the surface of our gums. And if we have these bad bugs in our gums that are like termites in our
Like termites.
foundation, they're getting into our bloodstream. And that's when they're found in our brains. That's when they're found floating all through our entire bodies. And adding to inflammation and disease in every part of our body. And
Yep.
so I want to stress that because that's one of the things that you have taught me that has made such an impact in my life. And it's the thing that I share probably first with anybody that asks me about what I'm doing with you or if they're talking about dental hygiene at all. I mean, I have told baseball moms, on the soccer field, I've told people like just so many people that one bit of information because I feel like we are not taught that. Hygienists aren't
No.
necessarily taught that. We've talked about that in another podcast, but certainly patients aren't educated on that. And when we're searching for information to better our health, how much easier can it get than make sure that you are doing what you can at home to have good dental hygiene?
Yep. Yep. And it is such a interesting thing too. I mean, they're on clots of people that have had a heart attack when they've taken out the clot. They find the same bacteria that causes gum infections in the clot when they culture it. And so we know these bacteria don't just stay in our mouths. I like to think of it as like if you get in contact with these creepy crawly bugs, like they just found some awesome real estate in your mouth. They want to stay there. So they're going to do everything in their power to stay there. And because of that, they're also resistant to just being cleaned away, which is why a traditional cleaning from your dental hygienist or your dentist isn't going to remove them. So if somebody thinks like, well, I have bleeding gums and I just need to go get my teeth cleaned, I'm overdue. Sorry, dude, like it's not going to work because
Right.
these bacteria have a superpower where they have this slimy, almost like a slimy layer that again is invisible to us around themselves for protection. So what that means is that if I'm brushing, flossing, using my dental picks as a hygienist, that actually only smears them around. It doesn't get rid of them. And if I have some really high tech tools, guided biofilm therapy, and these ultrasonics, and all these other different tools that professionals use, yes, you may be able to get them all out of the mouth for a certain period of time. but because they're also inside your gums, they're going to rebound and they're going to flush back into your mouth. So 5 hours later, you have the exact same bugs swimming in your mouth, which is why it's super important what we do for the patient in the practice, absolutely for treatment. So it's like if the car wash is for somebody that's really healthy, then the full detail is somebody that has an infection. So really getting in the nooks and crannies, places the patient can't reach, using antimicrobials, really flushing out and disrupting all those unhealthy bacteria. But then the person that has those bleeding gums needs to use a water flosser at home and then also consider some immune support. So some of that is in the ways of probiotics and prebiotics, eating really healthy food, getting enough sleep at night. There's some different binders that we can use that are some supplements that actually help to rid the body of some of these bad bugs. So there's a lot of different things that we can do. So what I train teams is we want to use a three-tier approach. So it's what are you doing for the patient in the practice? What are they going to do for themselves at home? And what about their immune system? So if I'm talking about somebody that's super healthy and maybe they just kind of took a dental sabbatical, they weren't doing a very good job at home, they may just need a little bit of catch up. But if I have a patient that has type 2 diabetes and they also have rheumatoid arthritis and they have a history of a heart attack, well, that person is immunocompromised. They have a lot going on in their immune system. So for them, I'm going to be saying, I need you to use your water pick twice a day at home. I need you to brush your teeth for 2 full minutes twice a day, hopefully with an electric toothbrush, every single
Yeah.
surface. Because when we're brushing, it's not just about removing food debris, it's about trying to disrupt and disorganize the invisible bacteria from every surface of that person's mouth. And also, don't go to Walgreens, Walmart, Target and go get just some over the counter mouthwash because a lot of it is actually really disruptive to your good bacteria because we're dentistry is looked at as beauty products. So a lot of the products that we're using in our mouth actually does more harm than good. Brands like Supermouth and things like that are actually really great because they work with your beneficial bacteria. So we
Mhm.
want to be looking at some of these products that are better for us. And I'll put some links in the show notes to some products that I personally use on in my family that are really helpful. But I didn't know any of that stuff when I graduated as a hygienist. Like I was like, mouthwash is mouthwash. It's all the same. And now I'm like, it's not? Okay.
Right. Well, and we're being educated by commercials. And
Yeah.
commercials, as we all know, are just to sell product. But the other thing is these bacteria that you talk about, you know, they're learning as quickly as AI is these days. They're
Yeah.
learning to protect themselves and continue to feed just that quickly. It's like in real time, they're figuring out how to survive. And so
Yep.
you've got to,
Yep.
like you said, disrupt that and maybe feed it something else that can trick it into thinking that they're doing well and thriving and then kill them off. Got to get them out.
Exactly. Exactly.
Okay,
I
so
think that
let's see.
go ahead.
What other questions do
You
we
go.
have here? Okay, this is great. Why do some patients get differing treatment suggestions from different offices and hygienists? I think that's
It's
twofold. It can be why do, like, you can take a husband and wife. The wife can go in and she gets a treatment plan, and then she sends her husband in because we know they're sharing the bacteria, and the husband gets a different treatment plan. It can also be that it differs from hygienist to hygienist within the same practice or office to office. So there's a lot to kind of like just
there
go
is.
down there,
There is.
but I think they all play.
They do, and this is, I wanna say this is uncommon, but it's not uncommon
Mhm.
because all of us have a different level of education and understanding, and there are so many absolutely fabulous hygienists and dentists out there. I mean, so many, and for the most part, I mean, we're all doing our very best every single day, but I can promise you, Lisa, that the Tasha that you would have had 15 years ago cleaning your teeth versus the Tasha that I am now would be radically different in what I recommend. And
Oh,
I
yeah.
promise that every time I would have been doing my very best. So most of it has to do with the level of education and understanding that our providers have had. And so there's so many facets to dentistry. I mean, we have the airway section and we have the cavities and the minerals and I mean there's literally just dozens of different, streams. And so because we're seeing patients all day long, we don't have an unlimited amount of time to educate ourselves with all the things that are changing in science. And so part of this is the more educated that our patients can be about their own health will help to empower them to ask the right questions. So if you're getting a very different treatment plan from your spouse or from your friend that sees the same practice, I would honestly just have a conversation with Claude AI and say, what questions might I ask my dental professional to better understand what they're telling me, because this doesn't feel right. I certainly in my early days thought of periodontal disease and bleeding gums and gingivitis kind of as a dirty mouth problem. And so
Right.
when I was talking to my patients about the treatment, the vocabulary and the types of things that I said sounded like that. And I'll never forget, I had this young man. He was a waiter, and funds were tight. He was already coming in every 3 months. I mean, I want to say he was in his late 20s, but he had a serious gum infection, and he had had a quote unquote deep cleaning before. And so when he saw me, maybe it was the third time that he saw me, and I kept saying that he needed this deep cleaning again, that we needed to get in the nooks and crannies and all this kind of thing. And he looked at me and he goes, Tasha, I just think you're trying to sell me something. And
Yes.
I remember I just didn't even know what to say. I was almost panicked, and I felt really guilty, and I felt bad. And I didn't think at the time that I was trying to sell him something, but when I reflect back, I was. And what I was trying to sell him is treatment that I knew he needed. And to this day, I know he needed that treatment, but I was clearly not explaining it in a way that he understood. I just didn't have the training at that time. And so
Yeah.
now what I understand is that when I'm communicating with patients, I need to communicate in a way that anyone can understand. I mean, even my husband, he knows all about dentistry because he has to hear me all the time. But he does not know dentistry to the point where I do. I talk to dental hygienists and I say, does your husband fully understand the gravity of a 5 millimeter pocket? Like what had to happen in the body for the bone to literally necrose and go away? And they're like,
Yeah.
no. And I say,
No chance.
so make sure that you assume that your patient doesn't know either, because they didn't go to hygiene school to learn it. Of course not. And so now that's how now when I train dental teams, I say, don't talk about this as a dirty mouth problem, because it's not. Some people might have hardened debris with their infection, but a lot of people don't. And so the cleaning that we really should be doing is a medicated cleaning. We need to be getting
Mm.
in the nooks and crannies with medicine. We need to disrupt and disorganize the bacteria. Not, well, Lisa, your upper right has some bone loss and some deeper pockets up there, so why don't you come back in and do a localized cleaning? Well, if the bacteria from your upper right can get to your brain, I'm pretty sure they can get to your lower left. So that localized cleaning, that's what we were taught in school. That's what they teach to this day, isn't quite enough. What we want that dental professional to do is at least we all have ultrasonics, at least disrupt and disorganize every single spot in the mouth. And then at home, the patient disrupt and disorganize, brushing full mouth, palate, even your cheeks, friends, getting a tongue scraper, getting a water pick, going on every single tooth, outside, inside. Even if you have tonsils, please gargle. Even gargling with salt water is really good because our tonsils can hold so much bacteria. And then, of course, it's the immune support thing. And sometimes that's as simple as get enough sleep at night, friends. We know that our bodies, that's when they heal. That's when your brain literally detoxifies, is when you're sleeping. If you have sleep apnea, wear your CPAP machine, wear your sleep appliance. Don't take those things lightly. If you have diabetes, think about what you're eating. Yes, you may be on metformin or one of these other medications, but nothing can compensate for the way that we treat our bodies. And we're all so busy now that we tend towards like the fast, easy things that can be kind of
Yeah.
damaging over time. Sometimes it's just that immune support is just taking a little bit better care of yourself.
Right. Well, and I think you also just hit on when you're trying to explain to a patient why they need a service. You and I have talked a lot about this piece that everywhere I go, they're either, they're wanting a tip, it's an upcharge for this, they're trying to upsell me that. It's all everything is an add on. And so I go in for a cleaning and I've been seeing this dentist for however long. And now suddenly they've learned, that what's going on in my gums isn't just going on in my gums and it's going on in my entire body. And it feels like snake oil. It feels like you're
Yeah.
just trying to sell
Too
me something
different.
to make your practice more money. And I don't have it. I don't have that extra money. But that's when something like the microscope comes into play
Mhm.
and it sells itself because so if I've told you this before and like being at events with you and things like that, I'm like, guys, you don't have to convince your patient. Show them the
Mhm.
slide,
You need to show them.
show them the sheet that you've made that says, look for these individual things. And if you see any of these, they're a problem. If somebody can see that they have these things in their mouth, then they're going to say, okay, so how are you going to fix this? What do I
Yep,
need to do? Rather
yep.
than you convincing them. And it stops being an upsell and
Mhm.
it becomes a valid issue that they can see with their own eyes. Because, like you've said so many times, these things are in the foundation, they're deep down in our gums. I can't see them until it's too, I see the repercussions and I see the side effect.
Yeah, you see the side effects of those things.
Right. But getting a microscope chairside is the answer to so much of these questions that hygienists specifically are going to have. So if you're a patient,
It truly makes our
call
lives so
your
much easier, but not all patients have yeah, not all patients have a microscope, but
but
yeah, I mean,
call
that
around
is
and
one
find
thing.
someone that does. Go see them instead.
Yeah, it makes such a difference for the patient and for the hygienist. I mean, for me
Mhm.
personally, I remember having patients that I would do the traditional assessment with my notch metal stick, my probe, my periodontal probe, and I didn't see any bleeding and the patient looked pretty good. And then I would start cleaning and I would see bleeding and I would be like, "Oh my gosh, I just told this patient that they looked really good and I was going to get them shined up and get them out of here." And then I was just flabbergasted because at this point I'm halfway through my appointment and I'm thinking, this patient already does such a good job. Like, why do they have this bleeding? And I was so confused as a young hygienist why that was because I knew that they didn't have a dirty mouth problem, but I
Right.
didn't know what kind of treatment they needed to stop the bleeding. And it
Well,
was
you don't
all
want to
so,
backpedal and be like, "Oops,
yeah,
sorry, just kidding," because
yeah, you
you
actually,
lose credibility. You lose that
yep,
trust with
yep.
that patient.
Yep, yep. And there's also salivary diagnostics, which are really great. There's definitely a lot more practices throughout the United States that use salivary diagnostics, and they don't yet have a microscope. And you can go to oraldna.com and look for a provider that has salivary diagnostics. And there's some other tools like that. Now that doesn't give you like the visual, like seeing the shapes on the microscope slide. I mean, that's another step. But that is one thing that is super helpful that people can do. So if it's like, well, I want to find a practice, sometimes that can be a little bit tricky, but the phase contrast microscope has certainly changed my understanding because also when I was able to see the bacteria that were causing the bleeding, I mean, it brought that mouth body connection so clearly because now I went,
Right.
oh my gosh, that's what's swimming in the blood that I'm seeing in this person's mouth. Those critters
Totally.
are swimming in the blood. And that same blood just came out of the patient's capillaries. And the capillaries are fed by the veins and the arteries. And the last
Yeah.
time I checked, all of our vasculature is connected. And so it like for me, it was this whole like aha moment. And for my patients, I noticed the exact same thing. It was like, oh, that's what's going on. So I do wish everyone would get a microscope because it helps that conversation look real. I do think photography is really helpful too, when practices will show their patients what we're seeing because when
Mhm.
you're laid back, Lisa, you don't know what I'm doing in your mouth. Like, I mean, you can
No,
kind of
I have
feel
no
where I'm
idea.
at, but you're not seeing what I'm seeing or even watching what I'm doing, you know? And so there's this huge separate piece that I think in dentistry when we can just show you versus tell you, it's
Mhm.
easier because showing somebody a problem, they already know what the solution is. It's like, oh. So then, I mean, even from a motivational standpoint, I've had spirochetes in my mouth before. They're very unhealthy guys. They eat out of both ends. They look like a little snake. They're nasty little critters and they have teeth. So I've had those in my mouth before. And I was like, oh my gosh. But I mean, talk about me being motivated to use my water pick every single night to spend extra time
Absolutely.
brushing to even get in an extra cycle of that water pick and, really take care of myself. Believe me, I was super motivated.
Oh, yeah.
Maybe because I was a Girl Scout.
I had the same kind of issue recently, and I went in, and my gal Amanda is digging in there, and she's like, "Girl, what's changed? What's going on? Because I've never seen your mouth like this." And, and I said, I know what it is. I know exactly what it is. My husband had an infection when his root canal failed, and I had not been flossing as diligently and using my water pick as diligently. I got really complacent and lazy for like 2 months. And it was right before I went in. And she's like, okay, well then here's what we're gonna do. And I went back in 2 weeks later or whatever, and she's like, Psh, you're good. But that's because I know what I'm supposed to be doing. I've learned all of this. And there's one more question that I was going to ask, and it almost seems silly to ask this, but I'm going to go ahead and ask it anyway. Just, with all that we've already shared and discussed, I still think you're going to end up having some patients. Throwing this out there is like the Hail Mary. They've always had bleeding.
Mm.
It's normal for them. Their family has talked about the fact that, yeah, my gums have, always bled too.
They've
It's
always
probably
bled.
just a familial thing, right? It's
Yep.
hereditary. That's just how our bodies do life.
Yeah.
I can't even
Yes.
ask that question
That is
anymore.
from a dental professional standpoint, that might be it's in the top 3 hardest questions to answer because I I just know I mean, I know so many dental professionals, and we all want the best for our patients, and I can say without I have never met somebody that was just trying to sell people stuff and, "Doctor needs a new boat," and these comments that sometimes patients would say, and it just kinda
Right.
takes you back because, I mean, we're healthcare providers, we're in the medical profession. This isn't an easy profession. We still love it, and we totally value our patients and their health. And so those kinds of questions, they're real, they're honest. And truly, if my whole family had always talked about this, it would be totally normal to me. I'd be like, yeah, we all have had bleeding. Like, this is no
Right.
showstopper, dude.
You're
Like, it's not a
desensitized to it.
newsflash.
Doesn't seem like a
Yeah,
big
you're
deal.
totally desensitized to it. So what we actually know now is that it's something like 10% dental issues are hereditary. But
Mm,
what the difference is with the periodontal disease bacteria, they are ultra contagious. So earlier I mentioned spirochetes, those little snakes that eat out of both ends with teeth. So those types of bacteria can literally live in more than one host at a time. So for example, let's say I board my dog and they drink out of a communal dog bowl. So he comes back with really stinky breath. So let's say he's opportunistic and he wants to always try to lick my face and lick my mouth. Let's say he has a spirochete and it gets up in my mouth. Nasty, even thinking about it. But let's say my immune system doesn't fight it off. So those spirochetes go, ooh, sweet. New host, love it. New house. I'm gonna just build my family here. So this infection just starts brewing in my mouth, and then I kiss my husband, and those same spirochetes can then transfer to his mouth. And then maybe my daughter comes in and she's really thirsty and she sees that I have a big old glass of water and she takes a swig of it. Well, now we have one big family of bacteria. And now we all have the same infection. And maybe it's just like this slow simmer of an infection, meaning nobody has this raging infection that you're brushing and you're spitting out blood in the sink. It's just this slow simmer that you can't hardly see. So that's what's happening in most of these families is that mom has bacteria in her mouth, maybe even while she's pregnant. Maybe the OBGYN says, well, it's pregnancy gingivitis, so don't worry about it after you have the baby, it'll go away. We used to think that. We now know that even these bacteria, if you have them in your mouth, it can actually make it harder for you to get pregnant. And the same is true for the man. It can decrease the swimmers, it can decrease their ability
mhm.
to impregnate the egg. The whole fertility piece is huge with gum infections. What happens within families is that we're passing these bacteria because we're living in a house together. There's no way that you're not sharing bacteria. So if you've been having this all your life and then, your kid has braces and everyone has gum inflammation when they have braces, and then it's just like you just keep passing it around, passing it around. And maybe sometimes it kind of gets held at bay and then other times it flares up and it goes back and forth like this, but you never actually get rid of it.
Yeah.
So when you've always had bleeding, chances are there's more going on. My colleague years ago had this little boy. I'll never forget. He was 8 years old, mixed dentition, had baby teeth and permanent teeth. His gums were so red and inflamed and bloody. I mean, it was so hard for her to get him healthy. So talked to mom and dad. He went through gingivitis therapy. I mean, talked to his pediatrician. I mean, they even threw an antibiotic at it because his gums were just so bloody, bleedy, bleedy. And we kept talking to the parents about, we really think that there's some type of contagious thing going on here. We really want the parents to come in. And so as finally after 2 years, I bet, the
Oh,
parents finally
geez.
said, okay, we'll come see you. Oh, but they always brought their son in every 3 months, this little boy. And then turns out they had advanced gum disease. I mean, extreme bone loss, both mom and dad.
Wow.
And so now looking at this child, it's like, oh, no wonder. Well, then we did saliva testing on them. And what do you think their saliva test came back with? The exact same pathogens,
Right.
exactly the same. And this is seen all the time. So it's one of those things that because we have treated periodontal disease very mechanically for a long time, We were always taught that once somebody this is what I was taught. Once somebody has periodontal disease, they will always have periodontal disease. But what that doesn't mean is that once you have an infection, you will always have an active infection. We now know that you can halt this infection. Now, if you've lost bone, you have recession and things like that, you can't always get that back without some gum grafting and some, larger intervention, but you can stop that infection. And it's the infection that's causing the problems to the systemic health, to the mouth body connection that we've been talking about. So that's really
Yes.
what we're striving for is if your gums are not bleeding, they're not inflamed, and everything looks great on your microscope slide or your lab test, like you're good. You've arrested that infection. You may not be out of the woods forever.
Yeah.
I've had I've been sick more than once in my life. So to get it back, but you now can kind of know what to do to keep yourself healthy.
Yeah. Well, I think that's all of my
I
burning
love it.
questions for today, but I know
Great.
we've got a laundry list of them. So we'll have to do another podcast to discuss
Absolutely.
more. And maybe people will write in and
Yeah,
give you some
that would be great.
questions that we can ask on
I
another
would love to
podcast.
answer people's questions. Awesome. Well, thank you everyone for listening to our bleeding gums conversations. I hope you got some great tools, tips, and tricks. And before I forget, I also have a 6-minute daily guide to a healthier mouth that you can download. That'll also be in the show notes. These are the things that I do myself at home and what I've also shared with my good pal Lisa here. So we'll see you guys next time.